Hey everyone, Mark here from Off Grid Medic. Thanks for tuning in today. I want to talk a little bit about a topic that I think is really misunderstood, and I want to give a little bit of clarification to what it actually is. And that is the term wilderness medicine. What the heck is wilderness medicine, right? Wilderness medicine, by definition, is medical care that is delivered when separated from definitive care or hospital level care by either time, distance, or circumstance. In the pre-hospital environment, street side, we operate within what's referred to as the golden hour. And that's the first 60 minutes or first hour from the time that a sudden injury or illness actually occurs until that patient reaches definitive care. In wilderness medicine, we actually train and we adapt our treatment methodologies to go well beyond that. We're talking about sitting on a patient for hours, maybe even days, depending upon your situation. So we've got time, all right? We're operating outside the golden hour. Distance, this is your distance to definitive care. Here in the United States, about 99% of the population lives within 1 hour of definitive care. Out here in the wilderness, things can become completely different, okay? You may not have cell phone reception. You may not have the ability to get from point A to point B. So these things actually contribute to loss of life and needless suffering without the proper training. And then the third point is the actual circumstances, okay? The situation that you find yourself in. Again, you may not have cell phone reception. You may be 6 miles into a 13-mile loop trail. So your treatment methodologies, your treatment techniques, and your treatment priorities really need to change to be able to adapt with that. Now, interestingly enough, the National Institutes of Health have expanded on that definition, and they actually say that in order for something to qualify as a wilderness medicine type event, that it also has to be a resource poor event. In other words, you do not have enough people. You may not have communication. You may not have transportation. You're definitely not going to have all of the gear that you would have available street side. I see a lot of other schools out there that are teaching wilderness medicine. And I look at their pictures, I see their posts, I look at their videos, and the first thing that I notice is they've got all this street side gear with them, right? That's not what wilderness medicine is about. Taking the emergency room to the patient is not practicing wilderness medicine. One of the biggest hallmarks of wilderness medicine is understanding the problem and learning how to improvise. Everything that you need is out here. You just have to know how to think outside the box, understand the problem, and know how to use it. So let's talk about what it takes to actually be really good at wilderness medicine. And I kind of like to look at this kind of like an old wagon wheel. So if you put wilderness medicine in the center of that, then you've got your spokes coming off of it. So what it takes to be really good at wilderness medicine. Number one, you just have to have a really good, solid educational foundation. Whether that is a 16-hour wilderness first aid program, whether it's an 80-hour wilderness first responder program, whether you've had some formal training at the college level that's actually medically oriented or not, you have to have that basic understanding of what the human body is doing and why you're seeing what you're seeing so that you can get ahead of these injuries and treat the problems before they actually get worse. So you've got that underlying medical knowledge to begin with, but it doesn't stop there. You also have to add to that general camping skills, all right? The ability to start a fire, the ability to source and make water safe to be able to drink or to be able to irrigate a wound with. the ability to put up a shelter if needed. Let's say you don't have any of that commercial gear with you. Then now we get into having some wilderness survival skills as well. And this doesn't have to be a really immersive thing, like, you don't have to go off and spend 30 days in the woods by yourself to be able to develop these skills. You can literally take a weekend class and be able to develop these skills and then master them on your own after the program. So we've got the camping skills, we've got the medical skills, we've got the wilderness survival skills. Navigation skills. Navigation's a huge thing. It's probably one of the most overlooked skills that's out there in the outdoor community. Most wilderness medicine incidents occur because someone got lost, the sun went down, they got injured, and now they died. So if we can get ahead of that, so if we can almost put this on like the safety side, if you will. We can prevent problems by having those navigational skills to keep us on track so that we don't put ourselves into a survival situation or into a situation where we actually need to use wilderness medicine skills. The ability to understand ropes and knots is absolutely huge. There are some very specific knots, super easy to learn, but they have very specific uses as well. The wrong knot at the wrong time, trust me, you're going to end up in a wilderness medicine type situation. You're going to need some care. I mentioned earlier the ability to improvise. That is absolutely huge. Take something like the common Ziploc bag. What is it? Well, number one, it's a container, right? It's great to carry our trail mix around and stuff in. What else is it? What else can I use this for? Well, that Ziploc bag is not only a container, it's also a hot pack, it's a cold pack, it's an irrigation syringe, it's a chest seal, it's an improvised glove or a piece of improvised BSI or PPE to keep all the patient's nasty stuff off you. So having that ability to think outside the box, making improvised traction splints off the landscape, using sticks and string, having that ability to improvise, absolutely paramount. General bushcraft skills, extremely important. Now, I'm not going to define bushcraft in this video. There's plenty of those videos out there where you can actually look and see what that is, what that means. But having some of those skills goes a long, long way. Having a working knowledge of medicinal plants, and not only the medicinal plants, but also the toxic plants, the dangerous plants that are out there, the ones that you need to stay away from. A really good friend of mine who's an extremely successful survival instructor, he actually teaches plant medicine on the approach of, I'm going to teach you the few that will hurt you or kill you, and then we're going to experiment with the rest. Because there's really only a handful out there that you really need to watch out for. The rest of them, there's certain criteria that you can learn with that. But anyway, just wanted to put this video out. Just wanted to put some clarification out there. Obviously, if anyone has any questions, anything like that, please feel free to leave a comment. You can find us on Instagram, Facebook. You can find all of our course offerings on our website, which is offgridmedic.com. That's all one word. You can find us out in Colorado. We've got classes coming up in Texas. Got a class in 2 weeks in Georgia. Got a class in 3 weeks in South Carolina. We're everywhere. So again, thank you very much for your time. Hope that this gave a little bit of clarification to what exactly that mystery term of wilderness medicine is. Keep tuned in. We've got some stuff out there that we're going to be putting out that's just going to absolutely blow your mind. So thank you very much for your comments, your likes, your shares, and of course your subs. Thank you. Have a great day. Be safe, and we'll see you whenever our paths cross.